Welcome to Wellness Wednesdays. I'm Dr. Thema Bryant-Davis, candidate for president-elect of the American Psychological Association. I'm a private practitioner, a researcher, a professor at Pepperdine University, and also a consultant. I am so glad that you have been a part of this series. And if this is your first time joining us, please go to our Facebook page and our YouTube page so you can benefit from the entire season. On today, we are thinking about both Latinx mental health and Latinx Heritage Month. And I'm excited that we have two wonderful guests with us here on today. The first is Dr. Miguel Gallardo, who is a professor of psychology and director of Aliento, the Center for Latino Communities at Pepperdine University. He teaches courses on multicultural and social justice, advocacy, and professional practice issues. Dr. Gallardo is a licensed clinical psychologist and maintains an independent consultation practice where he conducts therapy, forensic legal, psychological, and neuropsychological screening, assessments, and consults with organizations and universities on developing culturally responsive systems. I'm so honored that he recently shared with a group I work with here in Los Angeles to look at equity within the community. Welcome, Dr. Gallardo.
Yeah, thank you, Dr. Bryant-Davis. Happy to be here.
Oh, I'm glad you're here. And our second guest is Dr. Carmen Vazquez, who is a practicing clinical psychologist in New York City and a visiting scholar, clinical psychology supervisor at Columbia University Teachers College. Her clinical and teaching experience expands over 25 years. She directed the NYU Bellevue Clinician Internship for 17 years and founded the Bilingual Treatment Program Clinic at Bellevue Hospital in New York City. Presently works with bilingual and monolingual populations. Dr. Vazquez has authored several books and chapters, including Parenting with Pride, Latino Style, The Maria Paradox, and Grief Therapy with Latinos. She co-edited with Dr. Lillian Comos-Diaz, Thriving in the Cultural Borderlands. And we are so glad that you are here with us today. Welcome.
My pleasure. I am very happy to be part of this presentation as well.
Oh, beautiful. Well, I really want to start with looking at the diversity and richness within the community. And I wonder if you all could speak to the complexities of Latinx identity, as well as the resources, the richness of it, and the challenges that we find in the community. And I'll start with you, Dr. Miguel.
Okay, all right, thank you. First of all, I would say we're amongst Latinx royalty with Dr. Vazquez here with us today, so I'm honored to serve alongside her and talk about this today as well, and think about Latinx Heritage Month and whatnot. So, in saying that, I want to also just sort of acknowledge that I think that the complexities are not well understood, actually, in terms of who we are as people and the richness of our communities in many ways. I think even as I think about the term Latinx, which is much more used at this moment in time and continuing to be, I think, gain more momentum and whatnot. Still a lot of, I think, diverse perspectives about its use and meaning and whatnot. But I think nonetheless, it is important because it speaks to, I think, the evolution of our identities as Latinx peoples and what that means for us. And so I think there's something powerful about naming and being able to name who we are and how we see ourselves. And if you think about the terms that we have used historically, or that have been designated and sort of given to us in some ways from, whether it's a governmental perspective or some other views, those are very, I think, Eurocentric terms in many ways. Hispanic, even the term Latino in many ways has been identified as more of a Eurocentric label and identification. And so I think as we think about our evolution as communities, there is something important about looking at our complexities and the diversity within our communities. The labels, I think, that we have been given, and even the ways in which we identify ourselves, I think, have come from outside of us oftentimes. And I think those represent In some ways, the legacies of colonization, the legacies of white body supremacy, the criteria that we use at times to identify, who's Latino enough or Latinx enough, or what all those things mean. I think sometimes those things come from outside of us. And so I like the Latinx. I like our evolution. I like what that says about us, even if there's some disagreement about it or some uncertainty about it. It really kind of pushes away and the aspects of narrowing our identities and also making us more inclusive. Thinking about our non-binary, trans community members, LGBTQ community members, not relegating, representing, in Spanish we have the nouns are, the Latino, Latina, and in general, even if you look at the English language, at one point in time, the use of the word men were used to both define men and women. And so in Latino cultures, we are sort of kind of pushing back a little bit about that and saying, let's get rid of gendering altogether to a certain degree. So I think the evolution is important, and I think it also speaks to the richness of who we are. So I like the inclusivity and where we're headed. So I'll stop there and let Carmen jump in as well.
Well, so well said, Miguel. And the point that I would like to add is that yes, in terms of the complexity, it defines us and it really gives us a lot of richness. But as a clinician, and as you know, sometimes this complexity can be confusing, both to the member of our culture and to the clinician, that the people that are trying to help people from our clients that come to us for help. And also, even in describing us in the literature, it can be at times confusing because we are large, right? I mean, a large body of people. Latin America has 21 republics plus Puerto Rico. It's a lot of different points of view. And then to define us would require an understanding of what is it that also binds us. And I think that there are cultural components that bind us that are great, and there are cultural components that also bind and define us that are great, but also could pose certain conflict if they are understood from the main thinking, particularly when you are talking about the place that you have arrived. I have personal experience as having been myself person that has migrated here, and then also have seen this type of this a need for understanding from the people that are working or that I have trained, that are helping our client to define so many different identities, including the identities of the phenotype, right? The way we look, the way our nose look, the way our hair is, the way our bodies are shaped differently, and that there could be a danger if this is not understood, because then there could be a message where the whiteness or someone who's different than us can, quote, be better. So no, we are all great. And I think that this diversity is really what makes us so strong and makes us so part of the wonderful bigger picture that is the Latinx community, as you said.
Oh, thank you so much for raising that, the strength in the diversity, and also pushing back against those hierarchies or white supremacy, internalized supremacy, and being mindful and intentional about that, which leads me to the second question. When we think about the Hispanic paradox or the Latinx paradox, where the community faces so much oppression and at the same time outlives many other communities. And Dr. Carmen, you spoke to this issue of resilience. Can you talk about what you attribute that to, or what are the factors that help to sustain life in the midst of oppression?
Absolutely. And just a little bit before that, as you know, the Latinx, or he has been called the Hispanic Paradox, but right now we can call it the Latinx Paradox too, refers to also a point of the physical health that we have, which is not, it's perplexing because the recent migrants have had longer years, at least 3 years longer of life, than the other population as that has been looked at in the United States, and also the better health, or at least that is the way that this was being interpreted. Perhaps right now, after COVID, and after we examine what COVID has done to our population, our groups, maybe things will change. So the Latinx paradox also is, as you said, how can you explain after having been through so much turmoil, after so much difficulties in terms of, as Miguel said at the beginning, the colonial experiences that quite often have been very, very negative experiences, particularly for women, and the survival, the resilience in just no matter what, just moving ahead and just shining and moving up. I also would like to, so I think that the explanation could be that the message is always, we have to be better than, we have to work harder than, we need to show who we are. And that is great. But I also would like to, from the clinical experience, also would like to share with the audience that the having to be better than can be a very big burden in trying to then just be everything, all the roles that particularly a woman has to function with in her life, because we are daughters, we are sisters, we are wives, we are mothers, we are teachers, we are supervisors, we are researchers, we are on and on and on and on. We are functioning in the corporate world. So that the message is, we are good. We need to remember that we don't have to be super human beings. We are good, and we will continue being good, but we also have to face the reality and not necessarily absorb as and own those labels or those definitions that come from either messages, from either culture. So we must look at our strength again, that our ancestors have shown us, because they have been the one as migrants that have gone through the difficulties of adjusting to a new language, to a new culture, to a new place. And then for the benefit of the children, which the statistic is showing is working.
Oh, beautiful. And it's so important, as you named, to be mindful of one's ancestors when we talk about not just inheriting ancestral wounds, but ancestral wisdom. And so as you're naming, what are the ways in which people coped and survived and lived, and trying to integrate those into our lives. Dr. Miguel.
Yeah. So, really, really great, I think, context and foundation that Gottman mentioned. And, a couple things, stand out to me. I think one of them is that, even this idea of like, we have to keep doing and doing and doing and, and producing and whatnot. I mean, that I always want to, I appreciate what Gottman said about, we also have to kind of, slow a minute, because I think that notion of us having to always do, again, is sort of that the legacies of colonization in many ways, of having to continue to produce, one's self-worth, one's value. I always ask my students, like, how many of you heard from your parents, like, you don't take naps, and we don't rest, we don't take naps, and all their hands go up, and so I think we have to, I think, reconnect with and restore some of what has been lost along the way, as Godwin mentioned, around ancestral healing, ancestral strength, ancestral wisdom in many ways. And I worry that we sort of we're doing that now, but we've lost a lot of that. So I want to really hit home the point that one of the things that we know that has always been, I think, a buffer for some of the socioeconomic, socio-political, cultural context and environmental circumstances that we find ourselves in is having a strong being strongly ethnic rooted in our identities. Feeling a good sense of who we are, and having good ethnic identity. There was this great study, a Brown paper that came out. I think it was the National Fatherhood. I'm forgetting the exact name of the organization, but they did a Brown paper on connecting to root straps, not bootstraps. And there's there's something I think very meaningful and powerful about valuing who we are and seeing the wisdom and the strength and the resiliency and the creativity, and that's important. So I think one of the things we know is we need to stay connected to who we are and to where we have come from. And the further we get away from that, we know from research and literature that the longer we're here, sometimes our mental and physical health outcomes change. They begin to change a little bit. So I think there's something to be said about having a strong ethnic identity. Resting is also restoring and reconnecting. The NAP ministry, she talks about rest as resistance, and yes. I love that. And so we are used to resisting. So let's resist the notion that we have to keep, burning ourselves out and wearing ourselves down. And I think those expectations are not sustainable, and they're not as healthy for us. And I think some of that's changing a little bit. I hope so anyway. And but I think ethnic identity is crucial. I think, and reconnecting with our ancestral wisdom and healing is critical as well.
Yes, thank you so much for raising that, and the NAP ministry of us, as you both have spoken to, attending not only to our minds and our socio-cultural selves, but our physical selves, right? And so, what does health or wellness look like for us, and how we can engage in that radical work of nourishing ourselves. One of the things I really appreciate about your work, Dr. Carmen, is the trailblazing around the psychology of Latinas and looking at Latinx families. And I wonder if you can speak some about the Maria Paradox, and how, if in any ways you've seen it change over time, and kind of given that, what guidance or suggestions you make to Latinas and their families.
Sure. Wonderful questions. So the Maria Paradox, just a brief explanation, probably has been around for a while. Everyone has probably heard the term, but it refers to a focus primarily in the Latinx women or culture, where, in the times when we started writing about this, we call it Latinas, but it continue applying to the Latinx now, because it includes all of us, which is wonderful. So the expectation really, and I think as it applies to today, is that women, particularly, because this is a gender-specific expectation, meaning that women are supposed to function or behave. It's a behavioral expectation than men. And the assumption is that now, 2021, there will be significant changes in the behavior of women versus men. Women do this, women do that, men do this, men do that. And the answer is sort of, in terms of the changes, at least clinically, at least in my private practice. And when Thema introduced me, I think I probably sent the introduction myself, that I have been practicing for over 25 years. It's much more than that, much more than that. And training a lot of Latinx future clinicians who are out there now. And I continue supervising this population. So the answer is that it is amazing that still the expectation of behavior according to the gender, and in this case, then the Maria paradox, which is really that women are supposed to be superior to men and capable of withstanding all suffering. People will say, we don't do that anymore. Well, both the clinicians that are listening to this conversation and those that are not clinicians will probably recognize that obviously our way of thinking that relates to culture is very dynamic. Things do change. But on the other hand, the way the brain is structured, there are certain memories that stay within certain areas of the brain that are not as accessible as others. So we can be more rational, we can be more cognitive, and we can say, I am not going to do this. Why should I? I don't have the time. Or he or she should do X, Y, and Z. The truth is that between the rational and the emotional component functioning of the brain, the teachings of our culture are a lot embedded in that part of the brain that deals with emotion. And sometimes emotions are irrational. We all know that. And we even ask ourselves, why did I do that? Or why did I say that? Because it is emotional. So we are impacted. And the teaching that, in fact, I just had someone today in my office that the message was, you have to be pleasing. You have to please. It's a very educated person who's right. And we are dealing with this because the message is, in order for you to be a good, in this case, Latinx woman, you have to follow your culture. You have to be, again, as I said at the beginning, kind of like really almost a perfect specimen. Mm. And then a lot of, particularly, I see this in professional women, that they have achieved, they have money, they are independent at least financially, yet there are certain remnant, there's certain sense of guilt within the way of functioning the household that requires some time. I always call it changing the script. You have to change the script. The script is you have to be perfect. You have to be complete. You have to complacer. I mean, you have to be kind, simpatica, wonderful, at all cost. And that comes across in feeling less than, in feeling that maybe you are not really fulfilling those expectations. It is all, maybe not all, but it is quite there's a tremendous amount in the percentage in the emotions. So be aware that sometimes you have to look for the responses. You have to allow the dialogue to come through, and then do not assume that because a person is a successful professional, him or her, sometimes if you do couples therapy, those things might be there, and that there's not that anyone is bad or good. It's just it is part of, we don't go out without clothes. Well, unless we are in a nudist colony, because we haven't, which I haven't been in, but we are told that we must wear clothes when we go out. So it's almost like if you do that, if you go out without your clothes, then people will say, what's wrong with you? So it is all embedded in our brain, in our teaching. So our culture has teachings that then can impact the Maria paradox.
Oh, thank you so much. That is so rich. And Dr. Miguel, I don't know if you want to add anything around these gender roles and expectations.
Yeah, sure. Yeah. I mean, I think just as I think about it as a Mexican American male, it is hard for me to even think about myself as the human being I am today without thinking about my mother and the women in my life actually who have cultivated, who I am in so many ways. There were things that my mother and the women in my life have taught me that, I love my father, and he's a great guy. He's a man of his times. I love him to death, but there were things that he just couldn't teach me, and that only my mother and other women in my life could. And even when I think about my journey in psychology, I mean, some of the folks who within Latinx Mental Health who sort of supported me from the beginning and continue to have been women in that. And so I think it's always interesting to me because I feel like, as men, women, the women in our role, the women in our lives play incredible roles, in who we are, and particularly whether it's a grandmother, a mother, whoever it may be. And I think we have to shift ourselves too as men. I think we have to continue to shift in terms of understanding that. I think, I always find it interesting. We have terms and language, both in English and in Spanish, that are derogatory terms, that are demeaning and demoralizing to women. And at the same time, we lift up, La Virgencita, La Guadalupana, the Virgin Mary, and we talk about there are these two sort of opposing, ideologies that are always coexisting. And I think that always, I think, has been a concern of mine. It's like, how on one hand can we demean and dehumanize, and on the other hand revere and praise in some ways, the role of women historically, religiously, spiritually, whatever it may be. So I think we as men also have to continue to evolve and change, and we have to support other men also making those changes. Because I think if if I see another Latinx individual, male, playing roles and occupying a space in their family life, and whatever it may look like, the first thing I want to do is support that individual, and because I want that to be more the norm as opposed to an exception. And I will tell you, I think that is changing in many ways. I do see that changing, where I think men in our communities are really beginning to shift a little bit. And I think we as a culture of men need to support that and embrace that, and really examine that in some ways. I've always said that women are much more well prepared to deal with both home life and work life than we as men have ever been, because I think we're socialized to, go out and do and provide in some ways in a very traditional historical sense. And I think women in our communities have always been able to function in both of those domains well and successfully. And we have it. Even if you look at immigration statistics and data, oftentimes the gender roles shift in the immigration process, and a lot of times it's because women are much more willing and able to secure and occupy types of employment, do certain jobs, etc., than sometimes the men are, for different reasons. Maybe there's pride, maybe there's a limitation, whatever it may be. And that shifts sometimes those gender role expectations and socialization processes. And so I think we have to recognize that, and really, I think we need each other to I think make those shifts. It's a cultural shift. I still see those expectations being placed on young Latinas, though, today. Even today, a lot of my students in my program, who are primarily Latino, are still struggling with, how do I value and really honor my family and my cultural family values, while also sort of honoring what's important to me as an individual, and what matters to me. And sometimes there's a clash there. Sometimes there's still a little bit of a chasm there in some ways. And so I think we have to continue to educate, and really kind of shift the narrative, shift the discourse a little bit. I think we still have a ways to go, but I think me as an individual, I have two daughters, so for me, it's like I want them to know that who they are, and that they can do anything, and that their voice is great just as it is. And so we try to really be intentional about the messages we send to them. And I'll tell you, as intentional as we are, sometimes we're still manifesting some very stereotypical types of things unintentionally and consciously. They hear it out in the world. And so, we were trying to sort of raise them with like gender neutrality and, playing with toys that were, more gender neutral at times, whatever. It doesn't matter. Like we still got two girls who love princesses and who want to do all, so those things are going to happen in some ways, but we have to be persistent and patient. And my father would always tell me in Spanish, he'd say, don't get tired of telling them. No te canses de decirles, you got to keep saying it, even if you don't think it's making a difference. You just got to keep reminding and remembering and sending that message. And at some point it's going to stick and it's going to sink in some ways. And so I think we try to do that. And I think that's important. I want to model for them, as a man that, I can be emotional, I can be compassionate, I can be loving, I can be all those things. I can like the color pink. I can like the color purple. I can play with dolls. I can do a tea party. I can do all those things. And I think those are important messages that I think I need to be with my daughters and being able to sort of be present with them, but also not be afraid to share that with other men as well, that I'm okay playing with dolls and doing tea parties and whatever it may be, because I think those are models and messages that I think that's what I have some control over anyway. And so I try to really honor that in trying to also shift those narratives, those really narrowly restrictive narratives that I think are as hurtful to us as men as they are to the women in our lives who we value so much oftentimes. So.
Oh, thank you so much for speaking to that, particularly around fatherhood and men in conversation with men. I think within my community, the Black community, there are a lot of directives given to women, whether from that cultural space or from the religious space, from the family space, all these things about what women are supposed to be doing, and not a lot of dialogue, or you're naming kind of accountability for men having that with other men. So I appreciate you bringing that into the conversation. I want to ask you all, as I know many people who will watch are practitioners. We think about therapy for practitioners who are not.
Oh, we lose Thema.
Mm-hmm.
I froze for a minute. For practitioners who are not Latinx, how you would give some guidance around respecting and integrating culture without participating in appropriation. So the distinction maybe between integration or appropriation of culture. And I'll start with Dr. Carmen.
Well, I think we have to assume, even if we are knowledgeable of the culture, that the client knows best, that the client is going to inform us on how, when we're working with women, how she has experienced, what is her narrative. Naturally, within the narrative, hopefully we will have an understanding of what that particular culture is that we are dealing with. And in this case, if we are referring specifically to the Latinx culture, then as we had said at the beginning, the challenge, and the challenge that we all pose, is really that we are dealing with a vast different people. We encounter differences, or with just by the nature of being human. We are going to have different characters, different personalities, different experiences. But the experience that the person is bringing, Lilian Comas Diaz, my dear friend, and others, we have been applying a type of opportunity where the voice for the person that we are trying to help, where you are recognizing the importance of a voice. as Miguel was saying, that you mentioned, you giving your daughters a voice, or those that you are training, so that it is how your history, how your experience is impacting who you are within that context. So then the advice would be, you do have to become, we all have to learn about the differences, with the different experiences, the political oppression, the how the discrimination, or the lack of acceptance, particularly with women, as I said at the beginning, based on the way she looks, her body. Not that many people anymore, I hope, see Barbie as the model, but still the shape that the Latinx woman is going to, it's in our genes, the way we look. It is really quite often a very important inner definition, but based on the outside. So I think awareness of those realities, also awareness of the importance, as you said, of the family, so that it is absolutely normal for a Latinx a man or woman to call his or her mother or family or sister on a daily basis. And then that is not a measurement, that is not abnormal, that is not unhealthy. So to become aware, and then it is not expected that if you are not, we are all learning, so it's really, we not even also who were born and raised. I was born and raised in a Latinx culture, but the Dominican culture. So I'm a Dominican. I came from the Dominican Republic. Mm-hmm. I have to learn about the Mexican culture. I have patients from Argentina. I have to get myself acquainted with that. I have patients from Puerto Rico. I have patients from Chile. I have patients from Colombia. There are similarities because they are traditional societies, by and large, and with a lot of sharing the history of governments that have been oppressive. You look at a lot of the governments in Latin America, the experience of oppression, dictators, and also abuses of people, abuses of power, and then how that translates or continue. There's a continuum. If you are talking about people that have had a history, either their family or themselves, of migration, they have had that experience, and then they are oppressed or they are facing a new type of discrimination, where for some people, those of us, for example, that have an accent, the moment I speak, the moment I say hello, it is, and sometimes it is not with a bad intentions. Where are you from? I was at a wedding not too long ago, and the man asked me, with the best of intention, so were you born in America? I said, yes, I was born in Latin America. So, it is really an understanding of what is how is the person that you are helping. If you are a clinician and this person is coming to you, then again, do not assume that if a person is very wealthy, you might assume that that person has no problem. Well, that is not the case. It is also always asking that narrative. So it is your testimony. In fact, it's testimonial therapy. It is tell me your story, but it's your story within a context, the context of the Latinx experience, either yours or your ancestor. I don't know your testimonial. I don't know your you're not going to share it with me. And testimonial is a term that started in Chile when there were problems with the prisoners, and people were allowed to share their story within the relevance of the context. So that would be, I think, a way to that would be my humble advice.
Mm-hmm.
I appreciate that, the not making assumptions and then bringing us full circle again to the diversity. right? A diversity of experiences while we are, aware and recognize similarities, but also cultural diversities and the individual story. Dr. Miguel.
Yeah, thank you. I think I would also add to that that it's sort of similar to like you know uh, placing the onus and blame on the individuals in our communities who aren't doing well. Is that they're fully responsible for some of the ways in which we negotiate and respond to life at times, and when we're failing to acknowledge and recognize that the context and the systems in which we find ourselves are not well, right? So maybe we're adjusting and we're responding in ways that are very functional, adaptive, and whatnot, but the systems are not well. So I think it's similar to like our training systems and our educational systems are inadequate. They're inadequately preparing students and those regardless of where you come from to go out, and I don't want to say that to every program, but in general our model, our frameworks, I think oftentimes are ill equipping our students to go out and provide the services. In fact, I think they're actually perpetuating the exact things at times that we're trying to avoid, and that is, trying to get caught up with the shiny objects, the bells and whistles, the things that glow in the dark, treatment manuals, evidence-based practices, empirically supported this, empirically supported that. And while all that's helpful, and I think we don't necessarily need to get rid of those kinds of things, but I think without the context, I think Godwin mentioned the context, without the right context and the foundation, good, well-intentioned therapists are going to unintentionally violate other people at times. And so I think we have to deconstruct and decolonize the systems in which we're training our students and also the systems in which services are being delivered. Most of the systems in which our community members are going to receive services were not designed or built for us. And the policies and the practices that are being implemented when we go in to try to provide services and receive services there's an incongruence and there's a disparity between what our needs are and what we're receiving oftentimes in some of those service agencies and whatnot. So I think that on a large level. On a more individual level, I would say that people should slow their roll, step back a minute, know who you are, know your stimulus value, know what you bring to the table, know how you come across to other people, know what your privileges are, know what your biases are, ask someone if you don't know. Sometimes other people know those things before we do. Take a minute to just kind of step back, look at your position, look at your location in your attempts to try to provide services to folks who may not be from the same cultural, ethnic, racial background as you in many ways, because I think that's critical. We too often want to put the cart before the horse. We want to tell people this is what you got to do, this is what you should do, and we're not doing enough of, I think, slowing people down and going like, who are you in the midst in the process of going out and doing this work? Because who you are matters, and you understanding who you are matters in many ways. Because again, you might be the path to hell is paved with good intentions. And so we can't just rely on good intentions and that we have the treatment manual that's going to tell us what we should. That's insufficient. In fact, that's inadequate, and I would even argue unethical to just simply rely on those particular aspects of our work and what we think we may do. So I'd say slow down, create the space for us to be able to sort of be who we are. Start with what's right with people as opposed to what's wrong with them. We're trained to find out what's wrong with people, and we should be training our students and training people in workshops to find out what's right with people first and foremost, and then the other things will fall into place, and we can go from there. But what are the strengths, what are the resources that people are bringing, what's right with them regardless of their circumstances, regardless of where they come from, regardless of who they are. Anything out of context is going to look off base. inadequate, wrong, right? And so we need to, I think, again, what Carmen mentioned, contextualize, I think, people's, lived experiences, and see their value and worth, but know who you are, know thyself, go back to basics, know thyself,
Yeah.
and know what you bring to the table.
So important, because as you named, many times people want to skip to knowledge of other groups. What are the skills to use with this group? And not starting with that place of self-awareness and our own reflexivity and our own cultural humility, being tuned into that.
Right.
So thank you both. This has been such a rich conversation, and I know the time goes so quickly. So there are those who are listening who will definitely want to learn more. So I'd love for both of you to share kind of a favorite resource or two, whether a book you'd like to recommend or a website, a video series, anything that might enhance our learning, so we can continue on this journey. Dr. Carmen.
Well, my thinking is that this the awareness and the learning obviously should be an ongoing process. And of course, with access these days to the internet, to social media, there's plenty of information or opportunities to learn about resources. So what I would like to focus on is rather that is also try to focus on your because again we started with the diversity, and we would probably end with the diversity because it's a very important concept. Because Latinx, the definition of the community is so large, then each area, each country is going to offer something of wealth, of worth. I just briefly would like to give you an example as to why it is so important to become very aware of our history. Just go and find out about the history of Mexico, the history of the Dominican Republic, the history of Colombia, the history of Spain, so that we know what it is that happened. Yesterday was Columbus Day weekend, the celebration, and then there are many different ways of understanding how this has affected different people and different areas in Latin America. So one thing that applied, for example, to the Dominican people from the Dominican Republic, or the history, should then be looked at for Dominicans or those people that are going to work with this community. Very few people know, for example, that the first university in this side of the world was in the Dominican Republic. Before, there was a university in the United States. And then, so when I work with this applied to all of us. Hey, we have contributed, we have a history. Then I work with a person who was told in a very Ivy League school that we didn't have models. This was for an art class to follow. So to look better at the European models of masters. And she didn't know about Botero. She didn't know about Frida Kahlo. She didn't know about Diego Rivera. And so on, and so on, and so on. So it's important to learn about the history, our literature, and just then you will have strength and you have to say, no, we have. Every place in Latin America, we all have important contribution to offer, to have argument when people tell us that. So a friend of mine told me jokingly, well, we should be lucky because, we were found. I said, well, we were not lost. We were not lost. What are you talking about? So, it is that kind of a thing that I think these are the resources. They are everywhere. You can go to the library, to the university, in your program, ask your professors, the one that could guide you, of course. The one that can guide you appropriately. What resources should I really follow? And then also one last thing is the importance of having a chat with clubs in the university or your friends, your comadres, sisterhood, so that you can then watch movies, so that you can hear the music, so that if you like merengue, whether it is tango, whether it is bachata, whether it is the corridos or the rancheras. It is all part of us, and it defines us as the Latinx community to be very proud of. Not during the Latinx month, forever.
Yes, forever. I love it. Yes.
I'll just make it quick because I know we're sort of approaching our time, but there was a great book that was just recently came out last year. It's called Finding Latinx, in Search of the Voices Redefining Latino Identity by Paola Ramos. Very good book. I think it's a really a must read for folks who want to really understand the complexities and the identities and pushing boundaries and the political and powerful and surprising ways that our communities really manifest who we are and what that looks like. And then there's a couple of podcasts. One is called Healing Generations. It's out of the National Compadres Network, and it's I think really addresses how do you heal trauma and inequities in society. It's got a Latinx emphasis, and then La Cura podcast, which is also about decolonizing Latinx health and reclaiming traditional healing. I think is also another really good source with regards to Latinx communities. And then I'll give a couple of shout outs to some of our colleagues. Doctors Adames and Chavez Dueñas have a great IC race laboratory that they do a lot of work around Latinx communities. There's also the Institute of Chicano Psychology out of Austin, Texas. RasaPsychology.org is that website. There's some good resources there as well. So take a look at those. I think those are some good starting points. I think I want to emphasize what Carmen said, talk to the people who can guide you and ask those folks, and hopefully they have some more resources for you.
Oh, thank you so much. That is really wonderful, the range that is available from you all, talking about the interpersonal connection to the books and the podcasts. And I want to just echo what Carmen said, that we don't want to just think about it for this month, but whenever we are engaging, not only in our professional lives, but in our personal lives as well. And our lives are richer as a result of seeing the fullness of ourselves and the fullness of each other. Thank you both so much for being here. And for those who are watching, we encourage you to share it with a colleague as we all seek to help others thrive. Thank you so much.
Thank you.
Thank you.
Good to spend time with you, Carmen.
Likewise. My pleasure.